We must innovate to shape the future of our healthcare systems. Increasing health needs place large demands on innovation. You must make the best use of the resources available and take advantage of new technology. The first steps of an innovation project are often quite exciting. But innovation can also be difficult, costly, and time-consuming. All too often, innovations fail to provide health value or economic benefits. How can you make sure that your innovation projects will be valuable? With Step Up, you get help to make good decisions based on the potential impact of an innovation. Step Up is developed by researchers at C3, Centre for Connected Care, and is being used by health leaders throughout Norway. The Step Up method is a research-based approach that includes 4 parts. It helps you to base decisions on a solid foundation, choose a valuable solution that's possible to realize, agree on a shared roadmap for the implementation process, and become a solid innovation leader so that you can reach your goal. Let's take a closer look at the different Step Up activities. Impact analysis. Here, you estimate the value of solving a challenge by discussing the value for users, the clinical value and risks, benefits for the organization, and the financial impact. Service journey. By outlining a service journey as it's experienced by a patient, employee, or next of kin, it becomes easier to see where the problem lies. Knowledge review. Here you collect knowledge from interviews and from reading relevant literature and use the documentation to plan the next step. These 3 activities give you a solid foundation and help you to tackle the most relevant challenge. Impact comparison. In this activity, you use a visual comparison of potential impact to decide on the best solution. Benefits planning. Here, you identify potential benefits and plan how they can be measured once the solution is being used. These 2 activities help you decide on a valuable solution and give you a head start with planning. Vision and the big picture. In this activity, you work together on the future vision of the project and agree on the most important things that need to be in place. Implementation plan. Here, you get help to plan which milestones you'll aim for, when they'll happen, who's responsible, and the benefits you think you can achieve. These 2 activities align leaders and team members around a shared roadmap. Each of the activities work best as engaging workshops. You bring together relevant perspectives and anchor your decisions early in the process. You can use the activities in sequence or select the ones that are most relevant to you. And when you need to develop as a leader, Step Up helps you to reflect on your role and responsibility as an innovator. Self-reflection and self-motivation helps you grow as a leader and contribute to your collective success. Step Up has been adopted by health innovators throughout Norway. You can use Step Up to ensure a solid foundation, choose a valuable solution, agree on a shared roadmap, and stand strong as an innovation leader. Combined, Step Up provides support for important decisions step by step throughout innovation work so that the project succeeds. So step up and help shape the future of healthcare.